Hey, my name is Kristen, and I've been a provider with Maternal and Family Health Services for almost 15 years. One of the best parts about my job is working with individuals and families to help them really understand their healthcare options so they're empowered to make the best choices that work for them. Today, we're going to chat about reproductive health, the available options for pregnancy prevention and contraception, and the programs and care offered through Maternal and Family Health Services. Let's get started. So, what is Maternal and Family Health Services, and why is education like this video important? MFHS is an innovative health and human services nonprofit dedicated to meeting the needs of the community through information, education, and quality care. We provide services like WIC, which is the Women, Infants, and Children Nutrition Program, Nurse-Family Partnership, maternity care, and postpartum care. Now, on to the reason you're with us today. Let's talk about reproductive health. We see male and female clients of all ages, from teens to adults, and if you don't identify with a gender, please know we provide a welcoming, inclusive atmosphere where anyone can get the care that they deserve. As a healthcare organization, we promote an overall healthy lifestyle. This means taking care of every part of your life, including when to have a family. A common misconception is that reproductive health services means preventing pregnancy. That can be part of it, but we can also help you plan a pregnancy when the time is right for you. The important thing is, you should know your options and make a plan. As long as you aren't currently pregnant or had a medical procedure that prevents pregnancy, you qualify. So what is reproductive health anyway? It includes birth control, emergency contraception, cervical cancer screenings, breast health, and preconception health counseling. Testing and counseling for sexually transmitted infections, or STIs, pregnancy testing and counseling, education, advice, referrals, and more. Let's talk about birth control. If you want to start using birth control, or if you're interested in switching methods, definitely ask questions. Your providers are here to help you find the right fit for your body and your lifestyle. So for example, condoms and pills are really great options. You just have to remember to take your pill consistently every single day. If you're someone who's still in high school or college and you don't want to think about pregnancy for a really long time, a great option is an IUD or an implant. Those are what are known as LARC methods, long-acting reversible contraception. Most times we can get you started on birth control at your first visit, which doesn't even have to be in person. Through our telehealth option, you can meet with us over the phone when it's convenient for you. I've spoken to patients between classes, on their lunch break, while waiting for their WIC appointment, whatever works. So depending on the birth control method selected, you may not need to leave home to get started. We can send up to 90 days of birth control pills in the mail, right to your door in a discreet package. We also offer free condoms, so just ask. And while I'm sure this all sounds great, you might be wondering, how much does it cost? Depending on your income, your birth control may be free or low cost. We accept all insurances. If you don't have insurance, no worries. You might also qualify for low cost or free services even if you're insured. Say you're covered under another person's insurance and you don't want them to know about your visit. I can assure you it will be kept confidential. So, what kinds of birth control methods are out there? Hormonal methods stop the release of the egg from the ovary. It includes the pill, Depo-Provera, which is the shot, the NuvaRing, Nexplanon, which is the implant that goes in your arm, and intrauterine devices, often known as IUDs. Barrier methods like condoms and diaphragms block sperm from reaching the egg. Remember what I said earlier, condoms are always free, just ask. Emergency contraception should be taken within 120 hours of unprotected sex. It is most effective when taken sooner. As soon as you think you may need this, call us. Please note, emergency contraception should not be used as a regular form of birth control. Natural family planning identifies your fertile days when you're most likely to become pregnant. Options like cycle beads can help remind you to avoid sexual contact during that time to prevent pregnancy. Sterilization is an operation that makes a person unable to have children. It's permanent. We can help you locate a doctor if you decide sterilization is right for you or your partner. Abstinence means that you avoid sexual intercourse completely to prevent pregnancy, so no sex. Now that we've covered some birth control methods, let's talk about STIs. STI stands for sexually transmitted infection, and it was formerly known as STD, which means sexually transmitted diseases. If you have unprotected oral, anal, or vaginal sex, you are at risk of contracting a sexually transmitted infection. Remember, not all contraceptive methods prevent STIs. Even if you're on birth control to prevent pregnancy, you want to make sure you're also protecting against STIs. STI rates are increasing at an alarming rate. Even if you've been treated for an STI, you and your partner are still at risk if you engage in unprotected sex. If you decide you want to start a family, untreated STIs may affect your ability to become pregnant. You often cannot tell just by looking at another person if they have an STI. Sometimes people who have one don't even know it. MFHS offers testing, treatment, and counseling for STIs for you and your partner. In fact, we can help you get tested without even having to come into the office. We can mail testing supplies right to your home, or you can pick up everything at one of our locations. Then, you can do the test from the comfort of your own home. We'll have a quick conversation with you and get some basic information, and we'll have the test results back within 3 to 5 days. So now that we've covered STIs, let's talk about reproductive life planning and what works for you. Think about it. Do you know if you want to have children? If you already do have children, would you like to have any more? If you aren't planning a pregnancy, how are you preventing it? Do you need assistance in deciding what's right for you? Finally, let's cover a reproductive life plan. You can start your reproductive life plan at any time. You can plan if children are in your future and when. If a birth control method or prevention method is no longer working for you, let's figure it out. And you can get tested for STIs to know your status and get care if needed. In addition to deciding if starting or growing a family is right for you, a reproductive life plan includes how to take care of yourself with vitamins, diet, and exercise, how to plan when is the best time during the month for you to try to get pregnant, the benefits of a reliable support system, how to financially plan for a child, information on other important steps to take when trying to start a family, and referrals to other healthcare agencies for your specific needs. Thank you for taking a few minutes to learn about preventative and reproductive health. Please know Maternal and Family Health Services staff is truly a phone call away. We want to make healthcare accessible to everyone, regardless of insurance status or distance. Learn more on our website, mfhs.org, and find a provider near you at mfhs.org/locations. Our sister website, safeteens.org, is also packed with specific resources for teens and adolescents. You can even text SAFE to 57890, then ask us anything, literally anything. Please get in touch with us anytime and take advantage of our telehealth option. We're here to provide the care that works for you. Thank you for watching.